right. Hello, everybody. Today I'm with Dr. Brian Stahl and then Dr. John Gillis, and we're going to be going over some LASIK questions, playing a little bit of Jeopardy. We've never
Yeah.
done this before, so we're excited. But you guys ready to get into it?
I think so.
All
We're
right,
looking
let's
forward to
do
the
it.
Jeopardy format.
Awesome.
We'll start it off with LASIK basics for 1,000. It's a tongue twister.
All right. LASIK basics for 1,000. What is LASIK?
All right, well, I'll start it off. Well, LASIK is a corneal refractive procedure that uses a specialized laser to reshape the cornea so that you don't need glasses or contacts.
Yeah. Well, let's next down that list. Let's do LASIK basics for 2,000.
All right. LASIK basics for 2,000. How is LASIK performed?
Yeah, so when you come in for your procedure, we're going to go over what we're going to do that day. We give you a Valium that day because we know that you're probably going to be a little anxious. And we actually have a hand holder who waltzes you through the whole procedure, holds your hand through the procedure itself. You're only in the room about 20 minutes. And the process itself is we create a thin flap of the surface cells with a device called a microkeratome. And then we laser remodel underneath of that. Now, if you're nearsighted, that means your eye's too steep. We need to flatten things a little. If you're farsighted, we need to steepen things. If you have astigmatism, and most people have some astigmatism, then we need to straighten things a little bit. And then put the surface cells back. And interestingly enough, a lot of people sit up on the bed and go, oh my gosh, I can see so much better almost immediately. Now, it's still a little blurry, but some people are seeing better almost right away.
All right, let's stay in that same category. And the next question in that list, please.
All right.
For
What makes
3,000.
someone a good candidate for LASIK?
So that's often a question that people wonder, and they talk with their regular eye doctor, and they want to know, do they qualify? And people that have nearsighted, farsighted, or astigmatism all can potentially qualify. So anyone who has significant dependence on glasses or contacts in order to see clearly very well could be a good candidate for LASIK.
Yeah. And, there's some people that really have a desire, occupationally, if you're a firefighter. Dr. Gillis used to be chief ophthalmologist at Patterson Air Force Base. He did jet fighter pilots. As you imagine, you don't want a contact coming out when you're in active combat in the air. So they did a lot of war fighters. They did a lot of airplane pilots. And then, if you're having trouble with your contacts, you're getting infections, or you maybe can't even wear contacts, then those are especially good candidates for pursuing LASIK surgery.
Yeah, we definitely hear that all the time.
Well, what about next in the category?
All right. What do we need? Why do we need patients out of their contacts for 1 week prior to the exam?
I know this one. I'm just kidding. I just really love this button. It's just like too much to resist. You can't put a red button in front of me and not expect me to push it. All right. So yeah, when you come in, we want you out of your soft contacts for a week, hard contacts for about 2 weeks, and the reason is we want your eyes to breathe. We want them to unmold and go back to their normal shape. We want really accurate measurements because we're going to change how you see, hopefully for the rest of your life. So we want to be very precise about how we measure. So contacts, soft contacts a week, hard contacts 2 weeks before you come in.
I know that's definitely a common question that we get when we're answering the phones, but
All right, well, it looks like we cleared that category. Let's go to myths and facts for 1,000.
all right. Common myth. LASIK can't correct astigmatism, or is it only for nearsighted patients?
So that one is a great one. So lots of people in casual conversation, I know you probably get this all the time, Brian. I have astigmatism. I may not be a candidate, and that was old kind of a thought back when they were just starting. There were limitations on what the laser could do. Now we're on the many iterations, much more complex lasers that can do as nearsighted, farsighted, and astigmatism. So in fact, people with high astigmatism may in fact be very good candidates for LASIK.
Yeah. And we've all had patients who had so much astigmatism they couldn't wear a contact lens. And sometimes with a lot of astigmatism, your glasses are only clear when you look dead center and you look to the side and it's blurry. So a lot of people with a ton of astigmatism, and you've experienced that too, they're excellent candidates for have it done because they're kind of miserable with the other options, glasses and contacts.
Right.
What about next in that category?
Okay. Common myth. LASIK isn't safe.
Yeah, you hear that sometimes. LASIK is one of the most commonly performed surgeries around the entire world. In the United States alone, there's been more than 2 million procedures done. No one's ever gone blind from it. I started doing LASIK more than 20 years ago. I've done more than 30,000 procedures. And our patients, by and large, have done very, very well. Now, with everything, it's a surgical procedure. There are some risks. We're going to go over those risks with you. But there's risk to contacts too. And those people who are sleeping in their contacts, especially if you sleep in them for more than 3 days a row, by the way, don't do that. You can get ulcers, you can get problems. So if you look at the safety record, if you're wearing contacts for more than 10 years, you're likely to have had an ulcer at some point in that time. And LASIK might actually be safer than continuing to wear contacts for some people.
Brian, it reminds me of that old adage, it's safer to fly in a plane than it is to drive a car. So some of those perceived risks are, in fact, actually not as dangerous as you might think. All right, we'll do the next one in that category.
All right, myths and facts for 3,000. LASIK results aren't permanent or won't last, so it doesn't matter where you go.
Well, we'll say that is a myth, because as Dr. Stahl, he says, this is the vision that you'll have for the rest of your life. And who you choose as your surgeon is just as important as what your prescription is, and finding the right surgeon and place to get it done that you trust and know is going to take good care of your eyes. So we take that very seriously here at Stahl Vision, and we want your LASIK procedure to last you as long as possible. And there are chances that enhancements may be needed down the road, or if you develop cataracts, that can shift things a little bit. But we expect it to last a very long time.
Yeah. And we know some people will need a second treatment or enhancement. Our enhancement rate is very low. It's about 1/5 the national average, because we work very hard getting people done the first time just right. And 2%, 150 chance you might need enhancement the first year. We do enhancements for free the first year and greatly reduce costs the rest of your life. But it is a lasting procedure. It doesn't just wear off. Yes, you're still going to get older and have other eye changes, but it is a lasting procedure. Well, next in that category.
Moving on to the last one of the category. So myths and facts for 4,000. LASIK costs too much.
Yeah, when you start adding up who doesn't want to push the red button, right? When you start adding up how much you spend on glasses and cases and contact lens solutions and frames, I mean, frames are cute, but frames are expensive in today's world. Well, it doesn't take very long before you would actually save money. We have an online calculator that you can actually put in, are you wearing glasses only, glasses and contacts, how many years, and how much money you would save. Now, you don't do LASIK to save money, although some people will save money. You do it for the convenience. People want to wake up and they want to go. They want to be able to do things. They don't want the hassles of glasses and contacts. But yes, this is actually a cost savings procedure. Certainly over 5 years in contacts, 10 years if you're just in glasses, you're going to save money over the cost of continuing wearing glasses and contacts.
All right, so moving on to the new category of cost and financing. All right, and Dr. Stahl, I think this one's actually going to be for you.
All right. All right.
Well,
It's because we know you want to press the button over and over. So, what factors influence the cost of LASIK surgery?
Yeah, when you look nationwide, the cost of LASIK surgery is between $2,000 and $3,000 per eye. And there's great finance programs for that. But things that affect the cost of it is what laser technology you're using, what's the skill and the experience of the surgeon, is the pre-op exam covered, is the post-op care covered, and when you put all that stuff together, that's where people end up. At our center, we only use the best laser technology. We have the laser of its kind here in the Miami Valley. We have great experienced surgeons. I was the first person to do LASIK surgery in the Miami Valley, and we've done more than anybody else in the entire area. And we have a friendly staff. Your initial exams covered in the cost. All of your follow-up care is covered in the cost. So there's no surprises. It's a package price, and we have great finance plans that I'm sure we'll probably end up talking about later too.
Awesome. All right, Dr. Gillis, on to
All right,
you.
well, keep that category rolling.
Awesome. All right, so this is cost and financing for 2,000. How much does LASIK typically cost, and what is included in the cost of the surgery?
All right. So I'm going to cherry pick off of a lot of Brian's answers. So he'd mentioned it's typically on average about between 2,000 and 3,000 per eye, but that includes all the examinations, the measurements, the pre and post-operative care, and that's continued carried through that first year of surgery.
All right, moving on to cost and financing for 3,000. Do insurance plans ever cover the cost of LASIK surgery?
You would think that insurance companies would say, oh, yeah, let's cover the cost of that because if we're paying for people's glasses and contacts and exams and all that they would save some money too. But they don't think that way. They think how much money we're going to make this next quarter. So insurance companies do not cover the cost of it. Now, there are some insurance plans that offer a discount if you go to certain centers, and we honor that discount at our center. But none of the insurance companies cover it as an elective procedure. But we have really awesome finance plans that we'll talk about a little later on that make it affordable. And we want everybody to be able to fit it into their budget. But no, your insurance company won't cover it. Now, if you have an HSA account or an FSA account through your employer, you can use pre-tax dollars for medical expenses, and LASIK is a qualified expense, and so you can pay for it for pre-tax dollars.
All right, last one of this category, cost and financing for 4,000. Are there any discounts or special offers for LASIK surgery?
I
And
think
I
for
think
that one, I'm going to buzz Moraine in.
say special guest star.
Great.
Here we go. All right, so we do run promotions every month. So right now our current promotion is $1,000 off, and then we are doing a March Madness scratch off as well, where you could get the chance of getting up to half off your procedure. So come on in here with us. We'll get you some scratch offs and see what you could win. And then we do finance through a company called Care Credit and offer 24 months deferred interest through them. So a lot of different options. We just want to get you in here, see if you're a good candidate, and figure out what works out best for you.
Let's move to a new category, I think.
All right, what to expect for 1,000. When can I resume normal activities such as working or driving after LASIK surgery?
Yeah, we mentioned that most people, when they sit up on the bed, they're seeing a little bit better, but we do have some restrictions. We don't want you exercising for a week. I'd rather you didn't drive the next morning or work that next morning, but a lot of people are able to drive the very next day and get back to normal activities. So it doesn't keep you down very long. So most people are back doing a lot of activities. Certainly swimming and exercising to the point where sweating is out for a week or so. But and we'll go over all those restrictions. But you're back to work very, very soon.
All right, what to expect for 2,000. Well, patients need to use eye drops after surgery. Explain the importance.
So it's very important for your LASIK surgery, not only the surgeon to do a great job, but you to create the perfect healing environment for your eye. So the first part is the surgery, but then at the aftercare, you'll experience some transient dryness for the first few weeks and up to a couple months after surgery. So using rewetting drops that we give you some handouts and some samples of is critically important. In addition to the antibiotics and steroids that help reduce inflammation and reduce the risk of getting a rare infection.
And are those eye drops lifelong? Do they have to stay on
Oh,
those for the entire?
no, these are not usually lifelong commitments to any one medication. They're usually just in the early post-operative period. Now, the eye drops, the dryness drops you use for the first few months as needed, and we guide you as surgeons to help see what your eye specifically needs in terms of additional lubrication.
I know once you start using those, it's hard to stop, though. I love the way that it feels on my eyes. So I made me little buddies with those things. Awesome. All right, what to expect for 3,000. How long does it take for my vision to stabilize after LASIK surgery?
Yeah, most people are seeing some immediately, and then there's going to be some healing changes that happen over the first week. If you're farsighted, it's a little bit longer, but you'll see some fluctuations in your vision. But using your tears and things, people are seeing fairly stable pretty quickly. We measure everybody at 3 months, and that's where we see how close did we get. And again, in our hands, over 99.2% of nearsighted patients are seeing 20/20 with a single treatment. So people are seeing pretty quick and pretty stable very quickly.
All right, what to expect for 4,000. How soon will patients notice improvement in their vision, and what can they expect long term?
Oh, so just to kind of summarize that, the nearsighted patients and especially the big treatment patients will wake up out of the bed and notice an immediate improvement. Now that won't be crisp vision right away, but the vision will pretty quickly come around to very good vision and continue to improve over the coming weeks after surgery. Each type of prescription, whether it's nearsighted, farsighted, has its own little flavor, but the patients regain functional, very crisp vision in a fairly rapid time.
But next, same category.
All right, how long does the actual surgery take?
Yeah, you're going to be here at the center about 2 hours for your surgery day. You will need a driver that day. The actual surgery in the room is only about 20 minutes of that. So a lot of that's getting prepared, cleaning around your eyes, going over the preparations, going over your drops that you're going to be using afterwards. And then you'll be in the room about 20 minutes. And actual laser treatment time, sometimes it's as short as 4 seconds or maybe as long as 20 seconds, but it's a very, very short procedure.
All right. What are some potential complications or risks associated with LASIK surgery?
So as we had discussed before in the safety part, the risks of LASIK are very low. The biggest important part is initially getting the flap down and laid out and smooth nicely so it has time to heal. But the chance of having a rare infection is almost unheard of with the proper use of medications and cleaning the hygiene and cleaning the eyelids. So the risks are very low, and then inflammation can happen, but are usually very well treated with steroids and other medical treatments. Do you have any?
Yeah, and John, I know you've seen it too. Most people have certain things, and they're not even a complication. It's just you're going to have it. Most people's eyes are drier than they were before their surgery for a couple months after. We're going to give you tears for that. The first week, especially, people see rings around lights from swelling. Everybody gets that. If you're wearing contacts, and especially wear your contacts too long, you see those same rings around lights. So that's 100% of people that get that. And then again, serious sight-threatening complications. I've never seen a sight-threatening complication in my patients. In my experience, there are some that can occur. We're going to give you a consent form to go over those, but that's why people go see experienced surgeons. You want to see somebody that has a very low complication rate, knows how to handle problems if it does happen, and avoids the problem in the first place.
Awesome. All right. General for 3,000.
Oh, that's right.
Yeah.
Are there any alternatives to LASIK if a patient isn't a candidate?
Yeah. Great question. So the question was, what if I can't have LASIK? What other alternatives are out there? So, most people who we see, they're unhappy with glasses and contacts. If they were happy with their glasses and contacts, they're not showing up in my office. So there are some other alternatives. For some people who have a very high prescription and their cornea happens to be a little thinner, or if you're in combat situations, and again, John used to do people in combat situations, there's a related laser procedure called PRK. PRK doesn't have the flap, so we can do higher prescriptions without creating a flap. Because there's no flap, you don't have to worry about if you're in a hand-to-hand combat or if you happen to be a cage fighter or something like that, you don't have to worry about that flap coming dislodged. Now, sometimes as we get to be 55, 60, 65 years old, our lenses start to change on the inside of our eye. And that means that probably LASIK surgery is not going to be your best option. So there's another surgery called refractive lens exchange that actually works very well for those procedures. And now we have bifocal implants that we can do pretty much like we do with cataract surgery as well. So those people are still candidates. It might be a different procedure, but they're still candidates. So really from the age of 18 to the age of 80, there's going to be some sort of surgical procedure that we have available to us in today's technology world that we could help people see better.
All right. And last one will be general for 4,000. And this just happens to be a daily double as well.
Push a button.
Found the daily double.
All right. What is the most common thing we hear patients say after having LASIK
Oh,
surgery?
I know this one. I heard, and it was the exact same thing that I said when I had my LASIK. Is I should have done this sooner, or I wish I had done it sooner.
I think all LASIK surgeons are very blessed because we get to do awesome things, give people their vision back. But everybody says the same thing. I should have done this a long time ago. So.
All right, well, I'm going to come in here as well. I just want to thank everybody for watching today. Thank you guys for taking time out. I hope you enjoyed this platform and the way that we did it. I know our doctors love the buttons, so we'll see if we bring those back. But if you're interested in scheduling an appointment, you can just visit stahlvision.com and schedule your consultation there, or give us a call at 937-643-2020. And if you want to share this video with your friends, you'll be able to find this on YouTube at our Stahl Vision page as well. So thank you guys for watching and enjoy your day. Thank you.